evening, and thank you for joining us tonight. May is Melanoma Awareness Month, and thanks to your generosity over the years, we've raised $4.5 million. These funds have been used for public education, and I think we're making a difference, so thank you. So next, I'd like to introduce Kara, our daughter.
Thank you, Dad, and thank you all of you for being here tonight. It's so important to us. Our partner, Area 23, created a PSA called Little Miss Sunshine. And this dynamic PSA features a cell morphing into a mole with the tagline, "Melanoma likes the sun more than you do." 18 years ago, we produced a segment for middle and high school students around the dangers of tanning and the importance of protecting yourself from the sun. And it was called The Dark Side of the Sun. It's been updated thanks to Area 23 again for their expertise and their help with creating a more updated version of this for middle and high school students. Last Wednesday, we co-hosted a webinar with the Melanoma Research Alliance. Advisory board member Dr. Victoria Siegel has been so instrumental in creating this skin cancer update for hospital medical records. Because nurses are already accessing the skin of incoming patients, presenting this addendum on hospital records offers an opportunity to screen for skin cancer and educate the patient. This update has been adopted through the Long Island hospital systems, and we are anxious to promote it nationally. Kansas and Missouri have joined our National Skin Cancer Firefighter Education Program, which we initiated with the FDNY in 2021. To date, fire training programs in New Jersey, Connecticut, Fort Worth, San Antonio, Fredericksburg, Maryland, and the Ozark region have all partnered with Molly's Fund to alert firefighters about their higher risk for developing skin cancer and strategies to mitigate this risk. The NASDAQ digital billboard in Times Square has featured our public service announcement, courtesy of George Pappas. Thank you, George. If you're on social media, Instagram, Twitter, Facebook, please follow Molly's Fund, and the current campaign, which we do every year after Memorial Day, is around Be Shady. Please share with us how you are educating your children, yourself, and others about protecting yourself from the sun and being sun safe. Thank you.
I'm happy to introduce this evening Zachary Brown. Zach is a surgical oncologist and researcher at NYU Langone Health and the Perlmutter Cancer Center. His clinical practice focuses on treating patients with soft tissue cancers as well as gastrointestinal malignancies, with a particular interest in treating patients with advanced or metastatic disease. During his training, Dr. Brown completed a clinical and research fellowship at the National Cancer Institute. His current research focuses on the use of regional surgical therapies to manipulate the immune system to improve patient outcomes. Please welcome Dr. Brown.
I'm really honored to be here and speak with you all tonight, and thank you so much to the Begain family. I met them during my time here at NYU, and it's become really apparent how much of a change that they've made and how that they turned a very difficult situation into affecting so many people's lives and really have prevented so many people from developing a very difficult cancer that can be very hard to take care of. So I'm a surgical oncologist, so that means I do cancer surgery. I take care of people primarily with skin cancers ranging from basal cell cancers, squamous cell cancers, but also patients with very difficult skin cancers such as melanomas, Merkel cell cancers, and those can be very aggressive and very difficult to take care of. Skin cancer is a very common problem here in the United States. About 1 in 5 people are affected with skin cancer. And if we take a look into the perspective of what that means, about 1 in 8 women are quoted to develop breast cancer during their lifetime, and about 1 in 20 people develop colorectal cancer. So skin cancer is by far a very common issue. Another problem is that of that amount of skin cancer, about 5% of those are melanoma. but melanoma makes up about 75% of the deaths that occur from skin cancer. Very early in your surgical oncology training, they kind of pound into your head this notion that biology is king. And what that means is that you can't change a tumor. You can only change the way you focus and that you treat a tumor, and that you have to take the inherent characteristics of the tumor into account when you're treating that. So when we look at patients with melanoma, we always keep that into mind of what is the biology, how aggressive is this, because melanoma can spread, and melanoma can, as we know, affect many people's lives and cut them tragically short. With that said, as a surgeon, a lot of times people come to me because people think a chance to cut is a chance to cure. But many times that's not the case, is that I can't often cure people with surgery. A lot of times it is, but a lot of times it's not. When I started medical school in 2009, the systemic therapy options for melanoma were terrible. They didn't work, and they made people very, very sick. Since that time, we've come a very long way in the treatment and potential cure for melanoma. During my time at the National Cancer Institute, it was a very informative time of my training because I worked with some very well-recognized leaders in the field of not only melanoma, but of immune therapies. And really at that time when I got to see discovery, innovation, and courage of both patients and providers kind of all come together in innovation in how we treat these folks. So over the last decade, really we've developed great advances in the fields of immune therapies, of being able to use a patient's own immune system to find and recognize cancers, not only melanomas, but many other types of cancers. But a lot of this was developed because of the work that has been done on melanoma. So what I really hope is that I one day go out of business as a melanoma surgeon. I hope that I don't have to operate on folks with melanoma. And I think we're getting to that point where systemic therapies is going to be so good. What I hope that I do is basically clean up what the other therapies can't treat. So I think the number one thing, though, is the best way to cure melanoma is to prevent melanoma. We know what causes it. It's sun exposure. And I think putting the message out mostly to young people that you need to protect yourselves. The FDA is going back and forth about actually making tanning beds. They're really putting it out that young people under the age of 16 shouldn't use or can't use tanning beds, similar to what we use to restrict tobacco in these folks. So I think that's what we really have to do, and I think it's really work of people like Molly's Fund and the Begain family that putting that message out that really makes a lasting change. So thank you everybody for your time tonight. Enjoy the rest of your evening. Thank you so much.